Good afternoon, everyone. I'm John from HTN and welcome to this webinar today, and thank you for joining us. For this session, we will discuss how to deliver healthcare transformation projects successfully. And I'm really pleased to welcome Andy Willis from Central London Community Healthcare and Gabby Cohen, Director of Delivery at Isla. So thank you, Andy and Gabby, for joining us today. So for this session, we are going to start with a presentation from Andy, who's going to share a case study at Central London Community Healthcare. We'll then move on to some questions, and I'll ask Gabby and Andy some questions about successful and unsuccessful transformation, stakeholder engagement, to interoperability and implementation, and we'll ask for some of their learnings and advice around those. And then we'll go to some questions from you, the audience. So if you have any questions, please type them into the chat and we'll go through them towards the end of the session. So final thing to mention is this session is being recorded and there will be a write-up made by the HTN team, so you can read or watch the session back at a later date. And we have half an hour for this session, so I think we should get started, and I'll hand it over to you, Andy, if you can kick us off.
Great, thanks very much, John, and welcome to everyone who's come to join us this afternoon. Hopefully we'll share, as John said, we're going to share a case study and hopefully tell you about a few success stories and a few pitfalls so that you might avoid them. So firstly, if we just move to the next slide, please. So this is just a little bit about transformation. So this is a King's Fund definition, and I think the main point of this is that transformation is about change. A lot of times when we've had products or new products, or we've tried to undertake work which we've said is transformation, it's just been transactional. So we've looked to roll out something with minimal training and it sort of falls flat. And many of you, if you've done transformation before, you'll recognise that as a reoccurring thing in the NHS. And I think it's really important to look at transformation as a social movement. So it's getting people's buy-in. It's very much a hearts and minds issue. So there's a product that needs to be right, but when you're getting the staff buy-in, that is the important thing. So you need to be spending a lot of time making sure that you're really making sure that you're making this meaningful to staff, so it means something to them, and you're hitting what they want to hear and what is important to them. So if we can just move to the next slide, please. Okay, so this is an overview. So this describes, so obviously there's an ageing population, there's lots of challenges in all of the organisations. Most of my experience has been working in acute trusts, but I now work for a community trust, and we've got a lot of we'll all have a lot of challenges with restricted budgets and growing population. Sometimes we get hold of money, but then we can't get hold of staff to fill their posts. So what we need to do is apply technology. And I'm sure if you've been doing transformation in the NHS the last few years, you will have tried any number of technical schemes, some of which will have gone well, some of which will have fallen flat. What we've been looking for, this scheme came about during, it started just before COVID, but really took off during COVID, when we were looking at how can we digitize some of our offer? How can we really make efficiencies by engaging technology to do some of the work for staff to make their lives better and for us to improve our quality of service. So I think the provenance of this helpfully came from the ground up. So there were staff on the ground who had identified a need around collecting in information around wound care in a much more systematic way than they were currently doing. Previously, there were just some paper notes. People were occasionally taking photographs of wounds, keeping them on their cell phone, which I'm sure makes our IG colleagues cry. There's lots of difficulty with that. So what we wanted to do was work with a provider and come up with a way to get a really slick interface to help us improve wound care, because in community healthcare, one of the chief quality problems we have is around wound management and deteriorating wounds. So this is a really important one for us. So we met up with Isla early on, had discussions with them, and we spent a long time developing the product with them. And I think one of the keys to transformation is having a product that works. So one, the staff themselves identified the need. So they were bought in, they were in for this. The company that we worked with, Isla, were at the time a relatively small company. So we had a lot of access to them and we co-developed the product with them. So we had a tailor-made product which worked really well and that the staff could use. And I think they're the keys for this, because we ended up having something that, when you look at the take-up figures, you'll see a really steep curve of how staff have gravitated towards it. And I think what we identified was the need was there, the staff identified it, and the product is good, which helped them use it. So one of the key things that this product helps us with is productivity. And as I mentioned, we've all tried to apply technology solutions before. Often it can make life harder for staff. And this is really important because this actually enables improved communication, improved record keeping, but also some efficiencies. So we're a community trust. We've got about 5,000 staff, 4,000 of them are clinical. They do a lot of travelling. Anything that we can find that helps reduce travel time is a huge win for us. It makes a big impact, and you'll see that in our later statements. If you go to the next slide, please. Okay, so this is the objective, and I've kind of started describing this. So the problem that we were trying to fix was that we have got a lot of district nurses going around visiting patients, some of which have wounds, some of which at the starting point, others have established wounds. And we also have a TVN service, so a tissue viability service, who are our specialists. And what we were looking to do was to get the specialists' input, opinion and view on the day-to-day work of the DNs, who are not experts in wound care. They know a bit, but it will vary between each of the DNs. So we wanted to share the knowledge of our TVNs without having to get our specialist nurse to go and visit every single patient and assess their wound. So the way that we've done this with Islacare's support is to enable our DNs to take pictures of a patient's wound and track it in real time. So they take a picture each time they see the wound, so they can see, our TVNs can see the change in the wound over time. And that picture that they take with a narrative in a structured text box enables them to provide information that both they can see for their clinical records, so their clinical record is already updated contemporaneously, but also our TVNs, the specialists, can view it and provide input, and they can see the full history of what's happened. So we initially started out in the Southwest, so that was during COVID. So I was drafted down to the Southwest division. I was working in the transformation team at the time, started working with Isla. They'd already developed a product, and I supported then with the initial rollout. As I said, the rollout initially was fairly easy because the staff were really into it because they wanted it in the first place. And then subsequent to the rollout in Southwest, it's now been rolling out to the other divisions. So it's gone to Hertfordshire, Inner Northwest, which is the division I now work in, and all of our other boroughs. So it is rolling out trust-wide because we've identified a product that works, got it working well, demonstrated the benefit, and then could make the case to roll it out to our other teams, which we're now doing. And it is now much easier because it is now more along the lines of a deployment, because staff have already heard from their colleagues in Southwest that it's a good product, so they want to use it. Next slide, please. Okay, so here's the adoption figures. As you can see, so we've got 1,600 plus clinicians on board, and as I mentioned, our total clinician headcount is about 4,000 across our organisation. So you can see that with nearly half are enrolled already. We've got some specialties and some services that won't use it, so our total number that we would want to roll out to is probably around the 3,000 mark, something like that. But I know with the Isla team currently rolling out in my division at the minute. The number of photos. So yesterday, this tipped the 200,000 mark. So it's been hugely successful. People are using this product every day, multiple times a day, because it's a good product and they wanted it. And that's important things to remember. And the number of patients that have been cared for. So then 200,000 contacts relate to just shy of 20,000 patients. So you can see they are monitoring the same patients over a long period of time, which is as intended, so that we can see the difference. Next slide, please. Okay, so here's another. So this is submissions on the platform. So as you can see, if you look at 2020, October, the graph starts, we get to about June 2022. And that correlates with the periods when I was the program manager in CLCH for deploying the project. As you can see, when it moved to a different program manager, the line improves significantly. I'm going to suggest there are other factors at play, but there is a small chance that others might be better than I am. I will potentially put this down to the fact that the news had got around in other divisions, so other people, other staff members will have gravitated towards it. Next slide, please. Okay, and here's the financial benefit, so benefits realization. So as with all transformation projects, I think it's really important to make sure that we evidence what we do, because then if it works or it doesn't work, we can evidence it and people can learn from what we've done. And I think that's really important, because we've equally had a couple of technology products in the past that haven't gone well, and we've written it up and we've shared that learning so that other people don't go down it. So I think it's really important to make sure that we are monitoring the changes and the benefits, because it's helpful for the wider NHS to learn from that. So with the efficiency savings, we've got a lot of time saved for clinical admin around communication. If you think if you look at the number, like 1.2 million, everyone, oh, that's a huge figure. But if you think about the numbers we've got, so for 1,000 clinicians in a month, that's saving 0.25 of the whole time equivalents, so about 4 hours a month. So that's only to make that saving. It is only saving to make that. We only need to save 4 hours of each DN's time for 1,000, and now we're up to 2,000. That number will increase. Now, as with a lot of NHS trusts, we're trying to manage the rising demand. On the first slide, we referenced the growing age in the population. So a lot of times we're developing products and we make efficiencies, but we're just absorbing, rather than being able to take money out, we're absorbing the increase in growth. So that is, up until now, that is how we've been taking the benefits. However, this year, now we're coming to a point where we'll be fully rolled out. We feel that we'll be in a position to actually put in a paper to our Quality Safer Staffing Forum to reduce our staffing mix based on this. So we'll actually be able to put in a paper and reduce our, it will be perhaps a 10% reduction in some of our boroughs of staff in that area. So we will truly, genuinely take money out to make efficiencies. It's not going to harm a lot of our staff on the ground, because we have vacancy levels and the staff are using it, and it's made their lives easier. So it's a positive thing, and it's positive for the trust. And obviously, in terms of NHS maintaining sustainability going forward, it's very important. So in summary, that's that. I can see John's popped up, which makes me think I'm overrunning a little bit. So if I just hand over to John.
Excellent. Thank you, Andy. That was a great presentation and a great project as well. So keen to dig into that a little bit more. So my first question, Andy, is what is the difference between a successful and unsuccessful project, from your opinion?
I think it's about finding a product that staff want. I think a lot of times in the NHS, we have to roll out products because we're told to, because it's national direction. You know, we're told to set up a a certain kind of urgent care centre, for example, because it's international best practice. But it might not fit to our local situation, it might not fit what our staff want, and it might not work in our geography. This is something that the staff develop from the ground. So I think getting staff ideas about what they find useful is important, because this is a bottom-up approach. This has come from the staff. And I think working with a company that will work with you to develop a product is helpful, because then you can streamline it and refine it. So you make sure that you've got a product that solves a real world problem very well.
Fantastic. And just to take that forward a bit, at what point in a transformation product do you get to the stage where what does done look like?
Yeah, so for us, done is when the product actually starts to fly for itself. It makes its own momentum. So initially, we had to put a lot of legwork into speaking to staff, setting them up, getting the technical background work done. But it's got to a stage now where it is self-growing. So the word within our staff group is that this is a great product. It works. It's helpful. We have people contacting us, asking us for their login and a training to go on it. So for me, that is the answer. In terms of, if you asked my more operational colleagues, they would say, I want the X percentage of staff, so 80% of staff using it, and I want to take benefits out. And I guess in this case, so from me, from a transformation point of view, it's working. But even from an operational point of view, we've now got to a point, you've seen the stats on the rollout, that even our operational colleagues are happy with that it is rolled out. We've got, I think, probably another 1,000 staff to add on. When they're listed on and enrolled, it will be complete. But we're now at the point where we can actually start looking at taking the benefits out.
Excellent, thank you. And Gabby, can I come to you for your perspective, please, in terms of what's the difference between an unsuccessful and successful project, and what is fundamental to successful transformation?
Yeah, John, thank you. It's a great question. So I think for us, and really to echo Andy's point, wherever we're approaching an implementation, it's really about leveraging the stakeholder and the insights that they hold before you even design whatever the implementation or intervention is going to be. So we always start kind of by engaging with the clinical teams, the administrative teams, and we process map every single step of the journey. And that allows us to understand what parts of Isla's functionality we should use in designing a really specific and targeted intervention. Once that's done, it's fundamental to ensure that there are no technical blockers or any barriers to being able to access the platform. So we spent a lot of time kind of thinking about integration, interoperability, how data flows. At CLCH, we have an EMIS integration and a System 1 integration, so that data is always accessible. We reduce kind of the administrative burdens of all of that those kind of challenges. And then finally, having some kind of accountability structure is also incredibly useful and adds a lot of safety to the project. So having the teams being able to report into kind of a central structure, report into different kind of SROs or exec sponsors really means that the project has that longevity, and also that the teams that are implementing have that security that they're going to be able to escalate or receive support when they need it.
Great, thank you. And Andy, to build on from that, in terms of adoption, why was the adoption in this project so successful?
Yeah, so the product being good and to an identified need, certainly they really helped. I think we also had a ready-made set of champions for this product. As I mentioned, we've got the specialists in this area for us are the tissue viability nurses. They're a relatively small number of staff, so they're probably only 5% of our workforce. But they do see the majority of these patients, and they see looking after these patients as their responsibility. For them, they could see the benefits immediately, because rather than having to only see the most worrying cases because they have to go out and travel them, they're now in a position where they can receive feedback on all of the patients that may have a need for the tissue viability input. So because it worked for them, it was efficient, they could collect in the data and make more impact in their area, they've really driven the usage within the district nursing team. So they're really persuading them, saying, come on guys, get on board with this. It's really helpful. We'll be able to do X, Y, and Z for you. Just, you know, load on the system. So they were like a kind of a ready-made group of champions to sell it with their colleagues. So that's been a real bonus for us.
Great, thank you. And Gabby, can I come to you next, please, in terms of implementation? How do you ensure the implementation persists and then is sufficiently embedded?
Yeah, so this is a great question and something we spend quite a lot of time on, as you can imagine. Going back to kind of Andy's earlier point, when the need is clear to the clinical team, you'll rarely get that adoption and embeddedness. So when the team really understand kind of, or when the intervention rather is focused on solving a problem that they experience every day, and that's rarely salient, you're not going to have any challenges really about getting clinical teams to engage with that intervention and that implementation. It gets a little bit trickier when you're solving maybe a less tangible problem, or it's downstream, or you have an admin team solving for a clinical team. But once again, making sure it's salient, making sure there are no technical barriers to accessing the tech is what really leads us to being able to maintain those numbers long term.
Fantastic, thank you. Andy, who are some of the key stakeholders that need to be engaged to make sure transformation is successful?
Yeah, thanks. I think this one revolves around a technical solution. So I think the stakeholders normally for us are quite straightforward and well defined. So we have our clinical teams. We've got a quality function within our trust which need to be engaged, and they need to have all the forms to check that they're happy with what we're doing. We've got a clearly established operational route. We've got infection control. So the normal clinical development things were already fairly characterized, because we weren't asking for money from the system, because we were essentially this is driven by efficiencies in-house, so that self-funds. So we didn't need to engage commissioners. Our toughest thing has been engaging the technical side of it. So in order to make this fly in our organisation, we needed to engage colleagues in information governance. Again, if any of you on the call have had experience with information governance, you'll probably feel our pain a little bit. And also the other stakeholder, which is notable in this, Gabby mentioned, there are now integrations with EMIS and System 1. Again, colleagues on the line, if you've ever tried to deal with System 1 or EMIS to affect change, you realise that is a painful and arduous journey. So the normal stakeholders, but in this case, we had the technical ones as well. And all I would say is engage both really early, because it is going to take them some time to work through this.
Fantastic, thank you. And Gabby, what's your perspective? What role does interoperability play in terms of a successful transformation project?
Yeah, so this has been pretty fundamental, and why kind of pushing the rock up the hill of integration is something we're so very committed to. Kind of shadowing clinicians and having this feedback, it's really just not feasible to have 5 or 6 screens open when you're trying to visit a patient in their home and really have a streamlined clinic. So having that real interoperability, that real kind of consistency along a streamlined workflow is really fundamental for clinical teams to be able to use it in a really seamless way. And also from an IG and data security perspective, making sure that the data that you expect when you log into a system is there, it's complete, and it doesn't require any manual data capture is pretty fundamental to something like this kind of growing wings.
Great, thank you. So I've got one more question, and then I'm going to come to the audience for questions. So if you've got any questions, please type them into the chat, and we've got a few minutes to go through them. So the final question for me is for you, Gabby. What is the role of the supplier in digital transformation?
Yeah, so for us, at least, and the way kind of we see it is that there are really 2 key elements to this. There's the tech element, and then there's the behavioral and transformation support. From a tech perspective, it needs to be a really enjoyable experience for our users to use our platform. It needs to be easy. And if any niggles or challenges come up, we need to respond to that really, really quickly and efficiently to make sure that our users feel heard and that these challenges are addressed really like in a timely fashion. We actually have development teams that are dedicated to just that. So as we get insights on the platform, we're able to really quickly kind of implement them. And it really fosters some nice trust between us and our users when a suggestion's made and a couple months later you're on the platform and it's already there. So that responsiveness is kind of fundamental. And then from a transformation behavioral element, it's absolutely key that our users feel like they can come to us for additional training and support, that any anxiety around a new platform or tech in general is addressed. So we spend a lot of time making sure that there are kind of endless training sessions you can attend, we can do in person, but also just making sure that we've gone through the process of really understanding what you're trying to solve so that every intervention is adding value to our clinical users and our administrative users.
Excellent, thank you. Right, we'll go to some audience questions. So the first one is for you, Andy. Well, it's in two parts. So how did you optimize the use of the product post go live? And the second part is how responsive was the supplier to change requests?
Yeah, thanks. Yeah, they've been very responsive. So part of the optimization has still been underway and continues to happen now. So we went live and we got the EMIS integration happened fairly soon. The System 1 version took longer, but they've still been working on that with us. And they're also still developing the product. So we were interested in like an AI element, which their developers are looking at, and it's on their list that they're working through. So the product is still happening. Because the Isla team are linked in with a lot of our clinicians, they are getting the feedback from our clinicians live, and that's playing back into them. So they have been able to sort of self-pick up some things to change and have adopted them, but it is still a live development. There's lots more that we think we can do. Certainly around like the AI front and automatically measuring wounds and things like that. So there's quite a lot we still feel the scope, and they're actively working on it. But what was the second part, John?
Well, you answered it at the start. It was how responsive was the supplier. So yeah,
how efficient.
Excellent, thank you for that. The next question, I'll come to you both for this for two different perspectives. The question is, how do you manage culture shifts during the implementation? Gabby, can I come to you first for that one, please?
Yeah, absolutely. So I don't think it will come as a surprise to anyone on the call that sometimes when we're initially brought in to work with the team, they've been maybe burnt by technical implementations before, they're fatigued. Clinicians and administrators have kind of had huge tech overhauls over the past few years. So the first thing really for us is about developing that trust and making sure that we're centering kind of clinical and administrative input and voices when we're designing these implementations. The problem has to be defined by the key users, and that's what changes really the culture around the openness to change and the willingness to kind of invest in really learning the system and using it in every way that it can be used.
Great, thank you. And Andy?
Yeah, I agree with what Gabby said, and I also think it's just important that there's a product that staff find easy to use. It never ceases to amaze me how bad our staff are with technology. I've been in one session and one of our members of staff couldn't turn off the ringer on her phone, which is kind of sort of a little picture into the sort of level of usability that we're used to. But I think because the product is slick, it's easy to use, it integrates with the system, they can use it from their smartphone. It's a nice, easy to use product. And I think that has helped to make the transition. Staff need to find what their after solution needs to be easier than what was before it, to enable them to change, because generally, you know, that change journey is hard for quite a few of our staff. But for this one, as it is a product that works, it's been much easier to get that culture change.
Excellent, thank you. And we're just about to turn 1 o'clock, so we are up on time. It's gone extremely fast, this webinar, but thank you both for joining us to share your projects, your learnings and experiences. And this session has been recorded, so if anybody in the audience wants to watch it back, you can. We'll share that with you, and there'll be a write-up too, so you can read it back as well. Thank you to everybody for attending, and thank you again to Abby, Andy and Gabby for joining us today. So thanks for that. Thanks, everybody. I'll close the session.
Thanks very much. Good to see you all. Have a good day.
Thanks. Bye.